Yeah, high flow.
Some options are
Humidity.
in.
Oh yeah, you were saying that in his segment. It's good.
Thank you, Stan.
High flow and humidity.
High flow, high humidity. Most of these come prepackaged. You need water that's already in the container. Sometimes all you have to do is add water to it. This is not tap water. Okay, this comes from the manufacturer. This one's tap water. But at the hospital, it's prepackaged, sterile water, so it's still before inhalation. So, because it's water, it has weight to it. So, my technique is I put this down, I connect this to a flow meter, have this, and this base station. Then I plug this in. When I plug this in, this little ball jumps. When that ball in the flow meter jumps up, that means that this is now calibrated to the pressure of the wall outlet. If you have a flow meter and it does not jump, don't use it.
Yeah, I'll tell you
You
that.
cannot use it. That means its calibration is no longer.
You can record my sound.
So, I am going to connect.
It is rotated right
Tell
now.
me an indication
We've barely rotated.
for this air entrainment nebulizer.
I just got them.
Anybody, indication.
I guess he wants to take this.
We're on high flow, high humidity.
Sorry.
When I give this to a patient.
You have a artificial airway?
Artificial airway.
People who burn their face.
Okay, yes.
People who what? Burn their face.
So let me give you a general. The general rule is they need high humidification due to they need to thin out their secretions or keep their airways moist. That's the general. Now we're going to become more specific. And that would be my face tint. This is the face tint. Why would I use the face tint?
That burns to the face.
Burns to the face. Facial reconstruction, nose jobs, sinus surgeries. Okay? So, this is going to be designed when it goes on the patient to sit like this. Okay, sometimes like this. I have had a patient where their burns were so bad on their face that we just opened this up. We used washcloths, we rolled them to where this was like this. So for that patient, it was the humidification that was more important than the oxygen. Did you hear that? Okay, because this is way open, isn't it? Yeah. High humidity, face tint. Aerosol mask. Why would a patient need an aerosol mask? The aerosol mask is basically just a little plastic mask, right? Just like that. So why would we put a patient on an aerosol mask?
Patient comfort.
Patient comfort. Thick, nasty secretions, intact airway. All that good stuff. High humidity, high flow. And I said that I connected the bottle to the flow meter first, have the flow meter plugged in. Now, the reason I connect the bottle to the flow meter first is because if I connected the bottle, what am I doing right now?
That's the flow rate. For the calibration.
You're close. What's going to eventually happen, and I did it on this one earlier, was this outlet, this has springs and valves in it. This is 50 pounds of pressure per square inch. That's a lot at this one little outlet. So if you're putting a bottle on and you're rocking that flow meter back and forth,
Wear and tear.
it's wear and tear and a high incidence. This flow meter is going to blow out of the wall and into your face. And now there's a permanent leak. Now you have a high fire issue. The patient has to be moved out of that room. All because you were doing this. And the hospital has to call maintenance to come in to fix it. And if you know, most hospitals' maintenance is only on call.
You have to work order.
You have to put a work order in. It can take 24 hours. All right, so now this is aerosol tubing. Aerosol tubing, also known as corrugated tubing. Corrugated because of all these little ridges right here. So I connect this, and the tubing comes in a box, and it's all together. It might be 40, 50 feet of this stuff. You have to cut it. So my rule of thumb is that I would do 1, 2, 3, 4, 5, 6, 7. I'd do 6 to 7, okay? And then I'd cut another one that was 6 to 7, and then I'd go to the patient's room. And all of this is connected. I have, don't look at this right now, but I have all of this tubing together. It's going to my patient. I asked the nurse, does this patient get up in the chair? Is this as far as the patient travels? Is the patient in the bed? Does the patient go to the other side of the bed? Because that's how long you have to make the tubing. So, after I get that, I'm measuring it, the lowest point of gravity. Did you hear that? The lowest point of gravity would be where the tube sags. And where it sags, that's where I put my water trap.
You said it's a water trough?
Trough? Trap.
Water
It's a
trap.
trap. It's trapping the condensation. Because high humidity, what's going to happen? We're going to build up large water droplets in our tubing. And we want to make sure that it's draining away from the patient, and anything here is draining to the trap. Several different types. This one is nice because you don't have to touch anything. All you have to do is pop it and it drains. You can drain this into one of those plastic cups in the patient's room, like a graduate, like what they measure the urine with. Put it in that, then you pour it into the toilet. Anything that's in this is considered biohazard. Don't pour it in the sink. Don't recycle it, nothing, just flush it. Like I said, different types, they come in bag form, literally like a Ziploc with a Y. And I hate those because they rip and they tear and they leak. So, lowest point of gravity. So high flow, FiO2, so let's turn this puppy on. Okay. This is at 28%. Feel that? Yeah, everybody feel it. I can't fix that color. Okay. Feel it? It's 28%. So at 28%, this is an air entrainment nebulizer. That means that those air entrainment ports are going to be basically wide open, right? So if they're wide open, that means the total flow is high. everybody catch that. Where we want it.
That means the total flow is high.
Total flow is what's right here. So flow, air's coming in because the oxygen's coming through the port and bringing it in through shear force. And it's bringing it in, and it's turbulent, and it's taking it through the tubing, and it's blowing the patient's hair back, right? Now, if I turn this to 40%, do you hear the difference? Okay. You feel the difference in flow. Yeah, you guys, do you feel the difference? You're supposed to say, yeah, there's a big difference. And if you don't, oh yeah, I saw. You know.
Yeah, what?
Do you feel the difference between the 28 and this? So what has happened?
Right now, it's not low right now?
The total flow has decreased because I turned the oxygen up. Okay, so when I turn the oxygen up on this device, it's not your liter flow. It's this, the air entrainment. Adjusting the air entrainment ports adjusts the FiO2. And I think we should have live lectures and like I said,
So adjusting the air
we could probably do this outside.
Adjusting the
Air entrainment ports, yes.
that
Adjust the FiO2. So if I close, the more I close the air entrainment ports, the higher the FiO2. As I increase or open the air entrainment ports, I'm increasing total flow, but I'm decreasing the FiO2. Does that make sense? Because you have to think, if the air entrainment ports are wide open, it's bringing wind in. It's bringing that, the fan, I guess. So let's just say, my patient is on, what did I say, 40%?
40%.
Something like that. The patient's on 40%, and the patient is saying, well, I need more flow. I just don't have enough flow. Okay, air entrainment, what can I do?
air,
No, it said they wanted flow, not
more
oxygen.
liters,
So what can I do? It increases it a little bit. I
increase to 15.
So you can feel a little bit of difference.
So the flow gets higher, but O2 stays the same?
Yes. Now the flow only dictates the FiO2 on your low flow devices. Does that make sense? So I'll say that again. The flow, your liter flow of oxygen only dictates the FiO2 on your low flow devices. On your high flow devices, where you see on your air entrainment mask or on this device, if it says, and I say it's the little sheet, information sheet that you have with every one of these. When you open it up at the hospital, that nebulizer will have an information sheet saying at 40% FiO2, minimum liter flow is 8. So what does that mean? You can't go below 8. Can you go up to 15? Yes. You can't. Does not change the oxygen going to the patient. Only changes the flow. It's much easier to lecture when I have the equipment.
So the more you close the port, the FiO2 is increased.
Say that again, it's your math.
The more you close the port,
Yes.
that increases the FiO2
And decreases the flow.
and decreases the flow. Okay.
So let's say that I have this now maxed at 15. It's not going to go any higher than this. And my patient, when they breathe in, they're sucking back the mist meaning when they breathe in, they're taking it all the way back here, meaning the mist is disappearing. The flow's not high enough to use the meters. And the patient is complaining, I need more flow, I can't catch my breath. It's like, okay, so what am I gonna do? 50%, as I say in lecture. Should have really blown your minds. What's 50 plus 50?
50.
50, very good. Stay. You will speak to your equipment as you become a professional. You do, you're going to talk to us like, stop it. This is a Y adapter. They call it an oxygen couplet. That's what this, no, oxygen coupler, whatever. Does that not look like a Y to you? Does that look like a Y? Okay, so what does this mean? This means this goes in the wall. When you put a flow meter in or anything into these devices, do not wiggle it. Don't try to make it fit. If it doesn't fit, get a different piece. Okay? So I'm going to put this puppy over here. And thank you. Oh, just to let you guys know, I still have stitches in my hand.
What are the other fingers?
I went to the doctor on Tuesday to get my stitches out, and he looked at both of my fingers and he said I was overusing my hands.
The troubleshooting for each device.
So this incision was starting to break open, and he wouldn't take the stitches out of this one because he said it looked bad. And I agreed with him, it looked bad. Oh. Let me see. Flip you around. So, and it's a good thing I have all of this together. Can you imagine being an RT out there and trying to find all this stuff? It's not always where you would think it would be, and that's too long. I need a shorter one. Close. You would adjust these at the patient bedside. Never ever want your tubing twisted. If I was at the patient's room, I'd probably cut it right here. You always want to cut it in the smooth area. I'd cut it right here so that the Y would be straight like this. Catch that? Now.
This is like the catalog of iFlow, all-in-one system. Looks a lot different than the one we have.
This is stuck, so I have to use it.
This, user-friendly, CGMI, look nice.
So the Y then, oh,
The other ones you guys are gonna see out.
Okay, so lots of tubing, right?
Very,
If I set this at 50 and 50, and I set them both to 10
50 and
liters
50
per
to 10
minute.
liters.
Now, so we spent a lot of time talking about one of the benefits of
A little bit more than the other one. So let's just say my patient is still saying, oh, I still don't have it out. Okay, fine. Right? So, 50 plus 50 is 50. Now, let's just say that my patient, the flow is now meeting my patient's needs, but the patient's FiO2 needs to be increased. Say you need 60%, but you have to maintain the same flow.
Would you increase one to 70%?
You can, yeah.
And the one keep it 60?
You could do 70 on that one, it's maxed out, and I'd probably do 50 or 55 on this one. Well, how do I know for sure? I don't. So what do I have to do? That oxygen analyzer, and that will tell you. So the purpose of this, there's different ways to do it. I can set them both at 60, but I'm going to decrease my total flow. I need one of those devices to have a more open air entrainment to increase that flow, to maintain the flow. Because at 50, the patient was comfortable. But this air entrainment and this flow, but now we need to increase the FiO2 because the patient sat Are you following that? So I could do 70 and 50. I do 60-60. Probably not 60-60 just because I need the total flow. And I'm really hoping that hospitals are able to purchase more and more of those high flow nasal cannulas because those replace all of this. So tell me a complication with these air entrainment nebulizers.
They only go up to 15 liters.
Well, the flow meter does. Yes. But when you do the calculations, if you listen to the equations, that PowerPoint I had, and the equation, you would have to calculate to determine, I might actually be delivering 80 or 90 liters per minute to my patient right now.
What's the first gas that reaches your alveoli?
That's not oxygen, that's just flow.
That's why I bring this guy out.
Because it's set on 50% right now, so I'm delivering 50% FiO2, but the flow going to the patient, maybe 80 or 90.
Yep, absolutely. Okay, we breathe in, we breathe out. But there's still gas, right? And so when we start our normal inhalation.
The high flow nasal cannulas, best things ever. So the issue with these,
That, along with being stressed, along with getting tired, right, is not good. So,
empty water bottle, I just stop and think.
provide-
Because as this water decreases, the mist will decrease.
so fast.
If the flow is too low, there won't be enough mist.
Of that anatomic.
If there's too much water in the tubing, that will decrease total flow and the mist, which is part of it.
I've only gone against
Basically, wash all of that back out.
It'll decrease flow and
The mist. And remember, the humidification that we're delivering the patient can only be seen through the mist. If we're delivering enough mist, we're delivering enough humidification. Okay? So, now, let's say my patient does not have an issue with oxygenation at all. They just need the high humidification and the high flow for whatever reason. You can run it on room air.
Goes up to 40.
Did you see how that moved? That's bad. It's getting loose. Oops. And you want to be careful with these also because you can cross thread them, and once you cross thread them with some of the cheaper plastic, you bring the whole device. Alright.
The flow meter is gonna look exactly like the flow meter that you guys have on the wall. Except instead of going from 0 to 15, it's going to go 0 to 7.
Okay.
So, that flow,
Where would you connect this one at?
You can,
Oh.
most of the time you can just do it like that. You always want to
Okay.
analyze the oxygen closest to the patient. Okay? So that means right at where the tubing is. So I have this on room air. That means my patient will receive 21% oxygen, right? High flow, high humidity. Patient is complaining that it's loud. Oh, that is so loud. Can you imagine listening to that 24/7? That would get unnerving. I come in. That's too much because I lost too much of my flow. That's better.
What do you have it set on?
It says 70%, but is my patient on 70%? No, they're on room air. All I did was close the air entrainment ports to help with the noise, but that did decrease what? The total flow. So it's just one of those things you have to be careful with. Now, many times you may have this or any of those air entrainment devices. Someone's going to come in and say, "Oh, my patient needs more oxygen," and just turn it. Not good. Case in point, don't get mad at your nurses if the patient is on room air, high flow, air entrainment nebulizer, mask, but the sensors starting to drop. So the nurse goes in and does what? Turns either the flow up or changes this. This right here is your air entrainment port. So instead of it saying 40%, she may have changed it to 50%, thinking that she did something. But did she do anything? When I say she, it could be he. No, it's just room air. It's nothing.
So you're getting the same amount.
Yeah, 21% is 21%. So that is not for them to know. That's your job. You just need to go in there and fix it. They don't make you write their equations for their IVs because medication drops do not all weigh the same. They don't make you do that. You don't make them do this. Good? Okay, so now let's talk about the Venturi. Who had their Venturi mask out earlier? Me. Okay, well, never mind. I got mine. Okay, so this is my Venturi mask. And this is the cheaper one that the hospitals use. Most of them. The one that you have in your lab kit is the creme de la creme. It is the most expensive. Isn't that nice? And the reason it is so expensive is because these different flow rates, when you see the different nozzle sizes, okay, that is what?
That's money.
That's money. Okay, but as you can see how the nozzles on the inside, see how that white one is real small? So on your paper, what is white? What is the percentage of white?
Says it right here.
There it is. It's 31%.
So 31%.
6 liters per minute.
And so the blue is what?
24%.
Okay, so let's, okay. Oh my goodness. Can
It says the numbers in there.
So this is 24. Look at that really small. Can you see on the inside that itty bitty pinhole? You can't see that.
I know what you're talking about. I've seen it earlier. I've seen it.
I'm sorry, what's your name?
Elizabeth.
Elizabeth. Yes, you see how small that's a little pinhole.
Yeah.
Okay? So that is pushing that oxygen flow in at a really high rate because it's compressing it. It's taking it from that nozzle size right there. See that nozzle size? To that pinhole. Okay? And so that creates that shear force. It's pulling that room air in. It's like you have no option but to follow me. Get your ass in here. We're going to the patient. That's what it's doing, right? So, these are not designed like that. This has a little clicking mechanism.
Sounds good.
And I'm going to put it at 28%. So it adjusts. You have to pull it down and then you have to turn it. And you have to get it just right. So here are the air entrainment ports. So I have this going to my patient, and this says 31% is a minimum of 3 liters. Okay. So I have this going to my patient, and my patient has been on this for several days. The patient is complaining of his or her nose bleeding, lost their voice because it's so dry in the upper airway. Okay, they've lost their taste ability. So that means it's time for your bland aerosol. And because this attaches to the air entrainment ports, this hose must connect to air and air only. So now we have flow going to that air entrainment, and this is going to pick it up and cause it to go to the patient, right? Create that total flow. Do you see the mist coming around it? So, that's this device, this round device, should only be used with the bland aerosol. Remember that.
Only with the blend
Many
air.
And it has to be connected to room air?
Yes, this does, because it's because of the air entrainment ports. Okay. You will see this. Professionals still do this. I grew up in a Catholic hospital where I'd get my hands slapped. I kid you not. Sister Blondine would walk around with a freaking ruler. I worked in a 1,000-bed hospital. Best professional environment ever grew up in. Okay? So, this, what am I doing right now? I do not have this connected to any flow. What am I doing? To the device.
Restricting the flow, maybe? Restricting flow, maybe?
I am restricting flow, very good. So if I decrease the total flow going to the patient, yes, I have to take that off.
Do you attach it just to attach it, like how you have it right there, or no?
No, I just take the thing completely off.
Because the
So
other
like
professor
this?
told us to put that on, just so you know.
And if you need the bland aerosol, then you use it.
Yep.
Okay.
Only.
Only.
Now, the theory on why some professionals want this
When you
here
need the
is they
blend
say they're protecting
aerosol,
the air treatment ports
you
from
put
being
that.
included. Okay, well, you're causing your own restriction now. Textbook and the manufacturer for both of these specifically state this is only for bland aerosol. Good?
You use a trap model and hook it up to that?
Yes, you do. I was just using the small thing, so I didn't have to go through all of that. Just for that, you have to look at the stitches.
The water trap
I
thing?
don't know, problem. I've seen worse.
The water trap?
Yes. If the hose is going to be long enough and you've got the flow up, absolutely, you're going to use the water tap.
So it has to be a long hose to use that water trap.
Mhm.
So I think your textbook says 50%.
Cool.
Yeah.
Now, I didn't go over this with the other group, but I'd like to know when would I use it like this? What is this?
For a trach.
This is a trach mask. So if my patient has an artificial airway, did you hear that? They have to have high humidity. It's an absolute. So, if my patient has high humidity going, but